we discuss the causes of syncope here. So, if you have a 27-year-old woman who lost consciousness after standing for 2 minutes and she had nausea and warmth before passing out, that's most likely vasovagal syncope due to emotional stress or whatever reason. There are other causes of syncope. For example, if the patient have history of coronary artery disease, myocardial infarction, cardiomyopathy, then most likely the cause is ventricular arrhythmia. That's the vasovagal syncope. If the patient have hypokalemia, hypomagnesemia, or prolonged QT interval, then it could be Torsades de Pointes or long QT syndrome as a cause of syncope. If the patient has syncope after exertion, then most likely aortic stenosis. If the patient has sudden death or there's a prolonged QT on EKG, could be congenital long QT syndrome. If the patient have sinus poses, prolonged PR interval or QRS, then most likely sick sinus syndrome as a cause of syncope. If the patient have syncope after standing without other symptoms of vasovagal syncope, and if it's an elderly most likely, that's an orthostatic syncope or orthostatic hypotension, mostly due to dehydration. If the patient cough, sneeze, laugh, and then have syncope, that's called situational syncope. It can happen after swallow, defecation, micturition, and orgasm.